So let's start from the basics. What is autoimmunity? If there are some warning signs, some telltale signs that something is about to go wrong, what would those signs be?
And so when we think about an autoimmune condition, it's basically where our body is attacking itself. All disease is actually an adaptive response. The body's trying to keep us alive. It's a survival response. And so when we look at autoimmune conditions, we know that there's 7 main root causes. Okay, 7 main root causes. We have to unravel these one at a time. About 80% of people or so with different autoimmune conditions will see significant benefit when they just get their circadian rhythm down, their nutrition right, get good movement in, reduce toxin exposure, and do the things I talked about to help move toxins out of the body. About 80% feel significantly better.
We're back with Dr. Jockers for a new episode. In fact, I'm thinking that we should do an entire series with Doctor because he's like a treasure chest of information, and just 2 episodes aren't going to be enough, Doctor. I'm going to bother you and make sure that you do a few more episodes for us, maybe a big series actually, because I can see that you have so much knowledge to share and you're willing to share and you care, and it's important that the good word gets out.
Absolutely. Well, I enjoy our conversations, and yeah, you're right. This is life-changing and life-saving information. Obviously, you've seen your life changed in such great ways, and I have as well by learning this information and applying it. And so it's a blessing that we're able to offer this to so many people.
Yeah, I remember I had to start from scratch, and I was struggling because there was so much information available and I did not know where to begin. And, when you are in the thick of it, it's very difficult to actually going through something. It's very difficult to find the right information. There's so much of information available, and it's very confusing and can be extremely stressful. So I think that as a student myself, it's just really, really nice to have amazing teachers like you teaching us about nutrition and health. And I'm just glad to share this with my followers because yeah, they do follow me from films and entertainment, but it's also important that they get some valuable add-ons to their lives.
Yeah, absolutely. You're sharing what you're passionate about, and people care about you. They want to know what you're all about. And obviously, health has been such an important thing for your life, and it's something you're passionate about. And now you're able to reach your very large audience with amazing information that's going to make a big impact on so many people's lives. I mean, there's so many people out there that are dealing with chronic inflammatory conditions, mental health problems, cognitive issues, right? I know in the United States, Alzheimer's disease, cognitive decline is on the rise, depression, anxiety is on the rise, chronic pain, and many of these things can be taken care of naturally, right? It's a really healthy lifestyle is going to improve a vast majority of these health conditions. And so there's a lot of unnecessary suffering that's going on. And by you utilizing your platform in this way, you're really helping mankind in such a way that just as an actress and just doing films alone, you may not have been able to impact.
Thank you. Thank you for that, though. Today, well, my eyes have opened because of the situation that I was in. And today I want to discuss, because it seems like 1 in 10 people seem to have an autoimmune condition, and that those numbers are just rising exponentially. And it's surprising because I don't think 15 years ago India had so many autoimmune cases, and it's a sudden burst of autoimmune cases, and we're all quite surprised by it.
Yeah.
And we don't have any answers, really.
Yeah, for sure. And mainstream medicine is amazing in an emergency crisis situation. And it's life-saving. If you break a bone, if you have pneumonia, if you're about to die, you have a major hemorrhage or a wound, it's amazing. But when it comes to dealing with chronic inflammatory health conditions, it's not doing a good job. It's not really getting to the root cause. It's just utilizing medications and surgeries to fix problems that have been there, that have been developing for long periods of time. And it's like we're putting a Band-Aid over it It's kind of like if we were driving our car and the oil light, change oil, comes on, we can either go and get the oil change, or we could just take duct tape and put it over the oil, right? Put it over the light, right? And that's kind of what we do with medications and surgeries. And there's a time and a place for those things. But when we look at the root causes of autoimmune conditions and chronic inflammatory conditions, and we start to actually unravel it and get and address those root cause factors, that's when we start to see real lasting health results. And that's really what we want to go through today. But you're right, autoimmune disease, I mean, there's over 80 different autoimmune diseases out there, and they can affect any tissue in our body. And so it's really important that we start to understand this information.
Would you say that when one is dealing with a chronic condition, chronic inflammation, chronic disease, it is vital that they look to integrative medicine and not just traditional medicine?
Yeah, absolutely. I definitely think so, because lifestyle plays such an important role in these conditions. And so when we think about an autoimmune condition, it's basically where our body is attacking itself. The immune system is attacking itself. And mainstream medicine really doesn't have a rationale. Like if you were to look up on Google and you were to say, what causes autoimmune disease? They would just say, well, genetics, right? But the reality is, if it was just genetics, then we wouldn't have a rise in autoimmune conditions, right? And so we have a rise because of lifestyle. There's a genetic component, just like all of us have genetics that could express themselves in such a way that we might develop heart disease or cancer or whatever it is. But it's really, we say genetics load the gun, right? Our lifestyle is what actually pulls the trigger. And so basically, it's the lifestyle that we're living that's going to pull the trigger on certain genetics that could express themselves as an autoimmune condition or as cancer or as heart disease. So these things are preventable, right? And even if you've already been diagnosed with these things, there's a lot that you can do to help put it into a state where it's more dormant in your body and less expressive.
So let's start from the basics. What is autoimmunity?
Yeah. Well, it's basically when the body is attacking itself. And again, the body can attack any tissue in the body, or the immune system, I should say, can attack any tissue in the body. So if it attacks the thyroid, for example, we call that Hashimoto's if it's autoimmune hypothyroidism, or if it's autoimmune hyperthyroidism, we call that Graves' disease. If it attacks our connective tissues, it can create a condition called lupus, systemic lupus. If it attacks the skin, we can call that psoriasis or some other conditions that are out there as well. If it attacks the skin and the muscles, it's dermatomyositis. And I believe that's what you had. Is that correct? And so there's all these different types of conditions out there. Celiac disease, there's ulcerative colitis and Crohn's disease. And so the immune system is actually attacking its own self tissue. That's what's happening here with an autoimmune disease.
And why is it suddenly on the rise? I mean, it's not like if this is genetic, I don't know anyone in my family who has an autoimmune condition. So where did it come from?
Yeah, for sure. Well, there's a genetics play, research has shown that roughly about 30% of the role in chronic disease formation. So the other 70% is the lifestyle that we're living. And today's society, we live a different lifestyle than our ancestors lived. So our ancestors, the main thing that, if we go back, let's say 1,000, 2,000 years, the main thing that was killing our ancestors was systemic infections. So if they got a wound, or let's say they got hit by a spear or whatever it was, or they got a wound, they fell off a tree, they would get a skin wound, and oftentimes an infection would get in and it could spread into their vital organs and kill them. And they can die of pneumonia or meningitis or encephalitis if the infection got into their brain. So the body adapted and created this process called inflammation. And inflammation's job is to prevent against an infection getting in and killing us quickly. And so nowadays, you rarely hear about people, particularly younger people, dying from an infection. It's usually only very old, immunocompromised people that are really dying from bacterial infections and things like that. The immune system's really good at preventing us from dying quickly, but the immune process should be a short period of time. That inflammation process should be a short period of time and then it should turn off. And what happens in our society is we have all these stressors that are overloading our system and not allowing it to turn off. So for example, in our gut, so we have our gut lining in our small intestine is only one cell wall thick. So it's only one cell, right? Whereas in our skin, it's somewhere around 15 to 20 layers of cells between our skin and our bloodstream. And that's because our skin has got to obviously endure a lot of stress, right? And we don't want it to be easy to break through our skin and get to our bloodstream and allow bacteria in. Our intestines are only one cell in the small intestine where we absorb most of our nutrients. So it's only one cell that's connected, one cell layer connected all the way across by these tight junctions. And that's because throughout the history of mankind, getting adequate nutrients, getting adequate food, we spent more time in famine than in feasting, meaning that we had to depend on a good harvest and a good hunt. And there would be many times where we didn't have that. So we were going days oftentimes without food. So when we got food, we wanted to make sure our body was designed to get maximal absorption. That's how God designed us. And so in our society today, though, most of us have lots of access to food, particularly the more affluent we are, or if we're in a westernized country, we have plenty of access to food, right? We have to be intentional about fasting now. And so we can be eating all day, and our food has more chemicals and toxins now in it than ever before. And so if we're eating throughout the day, we're putting more stress, particularly if we're eating chemicals and toxins. We're putting a lot of stress on that one cell wall layer, and we can break and tear that layer, right? We call that intestinal permeability. That's actually the medical term. The layman term is leaky gut, right? And now that intestinal layer breaks down, and now large undigested food particles can get from the gut into the bloodstream, and also bacteria and bacterial toxins now get from the gut into the bloodstream. And the body says, wow, there's all these unrecognizable proteins, and there's bacteria, and there's bacterial endotoxins that are in the bloodstream. I'm at risk for an infection. So I've got to drive up inflammation. And so inflammation goes up. And that, again, should be for a short period of time, but then we eat a few hours later, and again, more proteins, more bacteria, bacterial endotoxins getting into the bloodstream. And we just keep dosing that every time we're eating. We are increasing the amount of abnormal proteins in the bloodstream and increasing the amount of inflammation. And the body thinks that it's under an attack from bacteria and bacterial endotoxins, and that it's at risk for dying quickly, right, from one of these types of infections. And so now over time, it will actually start to create antibodies to similar types of proteins. For example, the type of protein in wheat, gluten, is very similar to the type of protein that is in our thyroid tissue. There's a lot of links between people that have a gluten sensitivity or a gluten intolerance and Hashimoto's thyroiditis, for example. And almost all autoimmune conditions, right? In general, psoriasis, a lot of links between people that have gluten sensitivity and psoriasis, a lot of links between gluten sensitivity and rheumatoid arthritis, right? And so we start to develop these patterns where the body will start to create antibodies that will destroy self-tissue because of in a sense, it's called molecular mimicry, where because the protein is so similar and it's at a constant threat because this protein keeps getting into the bloodstream, it's attacking anything that looks similar to it. A good example for this would be if you've ever played the game darts, right? You have a dart board, right? You're trying to throw your darts, okay? And you want to get it as close to the bullseye as possible. And so a good, healthy immune system is really good dart player. It's very good at getting that dart as close to the bullseye as possible so it can take out whatever its target is. An imbalanced or disordered immune system, dysfunctional immune system, is like playing darts with a blindfold on. So now you put a blindfold on, you can't see, you don't know where the wall is, you don't know where the dartboard is, and you're just throwing darts. So now you're hitting the wall, right? You're creating damage in your home trying to play darts. And that's basically what's happening with the immune system. So it is dysfunctional, and it's really just trying to keep us alive. Its aim is survival, but it's damaging our own self-tissue. And we can live a long time with an autoimmune disease, a lot longer than we can with a systemic infection that gets into our lungs and destroys our lungs. But our quality of life goes down significantly, right? And we have a lot of unnecessary suffering with that.
I get what you're saying, but when it does affect you, you still can't like understand why, because you think you're doing everything right, and you think you have a healthy lifestyle, and you're eating well, exercising, and I was doing most of the good stuff. So it still boils down to like the question as to why me.
Yeah. Yeah, for sure. Well, every individual is going to express, I always say this, there's health, there's disease, but in between there can be what we call dis-ease, right? So if you were to write out the word dis and then put a hyphen ease. And so there's a spectrum there. And so before you develop chronic disease, you've been kind of sliding down this scale of developing dis-ease over time. And that's key. And so when we think about
any warning signs, maybe we should talk about the warning signs, because no one wants to get to have an autoimmune condition. And if there are some warning signs, some telltale signs that something is about to go wrong, what would those signs be?
For sure. Well, common signs would be things like trouble sleeping at night. If you're not sleeping well, if you're noticing a lot of changes in your mood and trouble controlling your mood, a lot of irritability, depression, anxiety, if you're noticing chronic pain in your body, if you're noticing that you have extra weight that you may have gained or weight that you've lost that you just don't understand why, right? You all of a sudden you lost 10 pounds or you gained 10 pounds and you just can't get it off. Those would be reasons. You're having digestive issues, acid reflux, constipation, diarrhea, a lot of these types of gut issues. These are early warning signs. So if you're noticing anything along those lines, skin issues, but maybe it's acne, maybe it's eczema, rashes, if you start noticing those things, you really want to take note. If you're noticing fatigue, brain fog, okay, take note of that. It may be that your body is under too much stress, right? You may need to back off. I mean, for you, you're an actress, right? So when you're at a shoot, you're working very long days, I'm sure, right? And I'm sure you don't have access to the kind of lifestyle that you would always want to live, right? When you're trying to shoot a long movie or something like that. From what I understand, it can be very stressful. And so that stress can overwhelm your system and put you in a state where basically your body's not able to adapt effectively. And that could obviously help lead towards developing some sort of autoimmune or chronic inflammatory condition.
So for someone who is going through chronic inflammation, where does that person, I think that the first step is to do traditional medicine, and you go through the steroids and the usual course, and then you realize that you need something more, and you reach functional medicine. This is the drill, right? I'm sure you're used to it.
Yeah.
And with most of your patients who have a chronic condition, this is the drill usually. So where do they begin with their healing journey? How does one begin with? Firstly, it's difficult to even process the fact that this is happening to you. So there's a time span for that. Like the person always usually thinks that they're getting better in a week or two, because that's what you're used to. When you're sick, you're sick for like a week, maximum a week, right? You don't expect to ever be sick for years.
Yeah, for sure. Typically in mainstream medicine, the main medication they use is what you talked about, steroids, which suppress the immune system. And for very short periods of time, steroids can be really helpful. But long term, there's a ton of different unwanted side effects that occur with those. And so it's not actually addressing the root cause, which is why the immune system is imbalanced. And I think that is really what you have to focus on. And like you mentioned, for most people, it's a shock and it takes them a while to get there. I know for me, I developed irritable bowel syndrome in my early 20s, and I was a personal trainer. I was very fit. I thought I was very healthy. I was living a healthier lifestyle than just about everybody I knew. And yet I was the one that was suffering. And so sometimes there can be a shock factor and just kind of a period of denial. But once you get through that, you just have to really try to understand how the body works, and that all disease is actually an adaptive response. The body's trying to keep us alive. It's a survival response. And so when we look at autoimmune conditions, we know that there's 7 main root causes. Okay, 7 main root causes. We have to unravel these one at a time, okay, or multiple at a time. One is blood sugar imbalances. And we've talked in the past about how we need to have the right amount of blood sugar in our blood and the right amount of insulin, which is this hormone that comes out and pulls blood sugar into the cells. And when our blood sugar is off, it's a significant stressor on the body, which drives up inflammation. So if we have blood sugar imbalances, typically because we're either under a lot of stress or not sleeping well and not eating well, usually it's those 3 factors that are going to cause blood sugar imbalances. So we want to prioritize good protein, healthy fats, lots of colorful foods in our meals, right? That's going to help with, from a nutrition perspective, creating blood sugar stability. I always recommend 30 to 50 grams of protein per meal, and then making sure you're getting some healthy fats from things like extra virgin olive oil, grass-fed butter or ghee. Avocado has healthy fats in it as well. So those would all be good things to add. And then lots of colorful fruits and vegetables. And if you're eating like that, it's going to create more blood sugar stability, which is going to take a stressor off your body. So that's one of the root cause factors. Another one is
you seem to be putting a lot of focus on blood sugar stability. So you mentioned that twice now. So I believe that this is really important as a first step.
Yeah, it's absolutely critical. When your blood sugar is high, you're creating more inflammation in the body. When your blood sugar is low, your body ends up producing more cortisol, more stress hormones. Those stress hormones create more permeability in your gut, so allow those proteins to get through into the bloodstream to drive up inflammation. So stable blood sugar takes a lot of stress off of your body.
But are all spikes bad? Like when I work out, I have a spike, and that's not always a bad thing, right, Doc?
Yeah, your blood sugar is going to go up, right? When you're working out, that's normal. It's because stress hormone goes up, but it's not going to then just go up and then drop and tank, right? And that's the key. So it's going to create better blood sugar. Exercise helps create better blood sugar stability. But what happens is when we're under too much stress, right? If we overtrain our body or if we aren't sleeping well, we're under a lot of stress, not eating well, then we're going to have these big fluctuations where blood sugar is going to go way up. It's going to drop way down. We're going to have reactive hypoglycemia where blood sugar drops too low. And now our brain cells, when we have reactive hypoglycemia, our brain cells are literally starving because we need that glucose in our brain. And so that's where we become hangry, right? Where we're angry and we have cravings. We get irritable. We can have a lot of mood issues related to that. Some people will develop headaches. Some people will even pass out, right? I mean, there's a lot of, especially young women that all of a sudden they'll just kind of pass out. And it's because their blood sugar has dropped too low. And that's a significant event. And so blood sugar balance is super key. So again, going back to that idea of 30 to 50 grams of protein, making sure you're getting healthy fats in every meal. So you should be thinking when you're planning your meal, where am I getting my protein from in this meal? And is it enough protein to help me get satiated? I recommend at least 30 grams in a meal typically. If you're real light, if you're leaner or real light, you might be fine with 20 to 25 grams, or if you're a child. But if you can get it up to 30, that's going to provide really good satiety. Getting some healthy fats in there, 15 to 20 grams or so. And then making sure that you've got some good colors, some good colorful fruits and vegetables in your meal as well. That will all help provide blood sugar stability. So that's a key factor. Another factor is toxins, being exposed to toxins. Most of us have a high toxin load. And what that means, I always think about it like kind of like a rain barrel, right? And so that barrel is collecting water, right? Normally we have these drainage pathways that are allowing it to come out. And so our body, we're encountering toxins, but we should be able to detoxify those chemicals that are coming in. But if we're not moving our bodies right, if we're not doing a lot of the other healthy lifestyle principles, those drainage pathways can get blocked. And now we're putting in more and more toxins from the air that we breathe, the water that we drink, the food that we eat, and the things that we're putting on our skin, the makeups, cosmetics, the moisturizers, right? Cleaning agents, things like that we're encountering. All these things have chemicals. And if we are bringing in more than we're able to eliminate, the toxic load builds up. Now that bucket starts to build up and then overflow. We don't actually notice symptoms until that bucket reaches the point where it's full and now it starts to spill over. Now, all of a sudden, our hair starts falling out. All of a sudden, we can't get out of bed in the morning. We're so fatigued. All of a sudden, we can't sleep at night because our toxic load has gotten too high. And so we want to do two things with that. We want to reduce our exposure to toxins by doing our best to change out our soaps, our shampoos, our air fresheners, things that we're breathing. We want to clean our air, right? I have an air purifier in my home. We use essential oils for different things, right? We don't have the typical scented candles. We have beeswax candles. We have essential oil diffusers. We have air purifiers to help clean up our air so we're not being exposed to these things. For cleaning agents, even something like white vinegar, actually, right? Like rather than using kind of all these chemical-based all-purpose cleaners, you can get more natural ones if you want to find those. I mean, you can, I'm sure, find those on Amazon. But even just doing something like white
vinegar? White vinegar?
Yeah, like you can use white vinegar, white distilled vinegar, and put in some lemon essential oil or citrus essential oil. And that's a great all-purpose cleaner that you can use to clean. The essential oil just gives it a good citrusy smell because white vinegar doesn't smell very good. But the vinegar is actually what's doing the cleaning, right? And so you can actually clean dishes with that. You can clean your counters. So you're not being exposed to all the chemicals in your typical cleaning agents. That's really important. So doing our best to clean up the air that we're breathing, the water that we're drinking, getting good water filtration, and the food that we're eating. So trying to go organic as much as possible. Organic food is going to have more nutrients and less toxins than conventional food. So if we get conventional,
detox our body from the toxins that we already seem to have piled up.
Important question. The first thing with detox is just reducing our exposure, right? The body's doing its best to detox, but if we're overwhelming it with the amount that's coming in, we're not going to be able to detox. So the first step is reduce our exposure. All the things that I'm talking about, right? And then the next thing is we want to make sure that we're peeing, pooping, breathing, and sweating those toxins out, okay? So hydration is really key, right? Making sure we're drinking a lot of good, high quality filtered water is super important. You should be drinking at least half your body weight in ounces.
Filtered water. Oh, do you mean like reverse osmosis?
Correct. Yep. Reverse osmosis is great because it takes out these chemicals. So your typical water municipalities, they're putting chlorine in the water and disinfectant byproducts. And I understand why, because a lot of water can be contaminated with bacteria. And they want to make sure, okay, you don't get that bacterial infection that kills you quickly. Makes sense. But that chlorine and the disinfectant byproducts are really toxic for our body as well. And so we got to filter those out. So if we're just drinking typical tap water, that's going to cause health problems. So getting something like reverse osmosis or distilled water will help get that gets the toxins out of there. So now we want to drink that. And we want to drink at least half of our body weight in ounces of good, high quality filtered water. Okay. And that's going to help move our bowels, going to help us urinate out more toxins. In fact, when I was in practice, one thing I would hear all the time from my clients, they would say, you know what, I feel a lot better, but I have to go to the bathroom like every hour. And I was like, that's good. I'm like, you got to pee your way to good health, right? So that's a way that we get these toxins out. So breathing, having good breathing practices. Breathing is a way that we move a lot of toxins out of our body, believe it or not. Okay, we have to have good bowel movements. So the hydration will help with that, right? If you're not moving your bowel, you should be moving your bowels at least once or twice a day, okay? And it might be more, right? But depending on how much you eat, you should be moving your bowels at least once or twice a day. And we want to move out all the toxins from the meals that we consume within 24 hours, right? So if we ate, let's say, lunch yesterday, the toxins, the feces from that should be out of our body by lunch the following day, ideally, or it's going to sit in there, rot, putrefy, and build up more endotoxins in our system. So we want to have good bowel regularity. That is super critical. So one thing I recommend for that is warm beverages in the morning. When you wake up, your colon is most active between 6 a.m. and 9 a.m. So warm beverages, whether it's warm herbal tea, warm lemon water, coffee, all those things can be really beneficial for helping you move your bowels. Good hydration in general helps. And then for a lot of people, movement helps. And so I recommend in the morning getting out and getting some movement in. For a lot of people, they notice that when they move well and they hydrate well, that helps them move their bowels more effectively. So those would be things I'd recommend. Definitely got to make sure you're having
Love
regular
a
bowel
good poop
movements.
talk.
Hey, you always feel so much better after having a good bowel movement. You know, what's interesting is they've been studying the microbiome. We've done a lot of research on the microbiome, the gut microbiome, which is all the bacteria in and around our gut. And what they found is that before a bowel movement, we have more of these bacterial species. When we wake up in the morning, we have more bacterial species than we have cells in our body. After the bowel movement, we have more human cells than bacterial cells in our body, right? And so, yeah, I mean, most of us have noticed that we feel significantly better when we move our feces. We get rid of so much of the endotoxins and so much of the toxins, even from cosmetics, from all the things we're being exposed to, right? Bad things in our air, all the different chemicals. A lot of those are detoxified, or they're captured in the bile that we release from our liver. And the bile is what actually gives your bowel movements the brown color, right? And so that's actually a critical compound formed in the bowel movements. And so we're eliminating a lot of these chemicals through good bowel movements. So that's really key. And then sweating as well. So exercise helps you sweat. You can also do things like infrared sauna, right? Which is great. Sauna in general is fantastic. I like infrared sauna the best. And the reason is infrared, which is a part of the light spectrum. We get infrared naturally from the sun. Infrared will penetrate deep within our body, right? Whereas like a steam sauna or a dry sauna, we're getting a lot of heat and we're activating heat shock proteins, which have a beneficial effect on our immune system, but we're not getting deep into the visceral areas, right? The kind of the deep fat. We store toxins actually in our fat. Even if we're lean, like you and I are both lean, we still have toxins being stored in our fat. And so the infrared will help to basically loosen that and move those toxins into our circulation, which is really helpful.
How
and
many
then
times
we
a week
can
would you advise someone to get an infrared sauna?
to get in an infrared sauna, I would consider it like exercise, right? So, you know, on average, if you can do it 2 to 3 times a week, I think that's great. Just like exercise. If you can do strength training 2 to 3 times a week, I think that's great. If your lifestyle allows for you and you feel good doing it more often, great, right? Like for me, I like to exercise. I like to do strength training 6 days a week, right? Ideally. And I feel great doing that. And so sauna can be used like that. It's a stressor on the body. Anytime you're under a lot of heat like that, it is a stressor. You don't want to overwhelm your system. You want a stressor that you can adapt to. However, there's a lot of great benefits to the sauna, but you can overdo it as well, right? So doing it a few times a week, I think is great. And nowadays, you know, it's one of those things where a lot of people thought, well, you have to pay like, what, $5,000 to get like a big wooden sauna and have the space in your home to have it. And that's great if you do. I mean, those are fantastic. A good infrared sauna that you can do like that. But nowadays they have portable infrared saunas that are like sauna blankets. Like I know we're fortunate enough, my wife and I are fortunate enough to have both. We have the sauna blanket, which is like $600, $700, right? So it's still an investment, but significantly less than the $5,000 wooden sauna that we have in our home gym. And so we actually use the sauna blanket more than our one in our home gym because it's just something like at night that we can do after we put our kids down. We can get in that. My wife and I can have a conversation while she's in it and her head is out of it, right? And her body is sweating. It's also more tolerable, those ones, because your head's not in it. So even though your body is really sweating in these sauna blankets, you don't really feel it. And you can just fold it up and you put it in the corner of your room. So they're becoming more and more accessible, which is a great thing. It used to be a high barrier of entry for people to get access to a sauna. Now it's becoming a lower and lower barrier of entry. So more and more people can get access to this sort of healing technology. But all those things are great. And if you can't get a sauna, get out every day and get some exercise in, get some sweating going by working outside or exercising outside. So that would be the ways that we're moving these toxins out of our body. There's a few other big ones, right? One is circadian rhythm dysfunction. So our ancestors went to bed when the sun went down, right? Or shortly after the sun went down. They may have had a fire and been talking, but they went to bed earlier than we typically do in our society. We have lights, so we would keep the lights on. We can tell our brain by having blue light, by having a lot of light on in our home, that it's daytime when it's really nighttime. And that's not conducive for good health. What happens is at night, when the sun goes down, we naturally start producing more and more melatonin and more growth hormone. And melatonin and growth hormone are our anti-aging healing hormones. And so both of them help to protect our mitochondria within our cells. They help our body to preserve lean body mass, bone and muscle tissue, burn fat, and they help balance the immune system and reduce overall oxidative stress and inflammation. And so super important that we're getting the optimal release of melatonin and growth hormone. If we have bright lights on at 10 o'clock at night, we're not going to do that. We're suppressing, we're inhibiting or blocking our ability to produce these hormones. So having a good circadian rhythm where at night when the sun goes down, we start winding down. On a previous podcast, we talked about wearing blue light blocking glasses at night and dimming the lights. The blue light blocking glasses make everything look orange in a sense, right? It kind of gives everything an orange tint. Similar to like our ancestors being exposed to fire.
If melatonin is an antioxidant, Doc, why is it so bad to supplement with melatonin?
It's not. Actually, it can be really helpful to supplement with melatonin. Some people will say that, but actually melatonin supplementation can be extremely helpful and beneficial. Yeah, I actually supplement with melatonin. It helps me sleep deeper and more restoratively. Some people don't respond as well. There's a lot of myths out there. You're not going to stop your melatonin release by doing that. What stops your melatonin release or blocks it or inhibits it is being exposed to blue light at night. That's the main thing that blocks it. Number 2 would be having a lot of goals at night, right? Like you've probably done this. I know I have, especially when I was a teenager or when I was a young adult in college. It was like, oh, I get my second wind. I want to study. I want to do this until 2 a.m. in the morning, right? And so we're blocking melatonin when we do that. So I tell people wind down and don't have any major goals after 9 o'clock at night. You might read a book or have a conversation with your spouse or significant other or friend, but no major stressful conversations and no major goals that you feel pressure by, right?
What is the dosage of melatonin that I can take?
You know what? Honestly, for cancer, there's a lot of integrative clinics that are using high dose melatonin with cancer patients, right? I mean, I'm talking about 100 milligrams a day, and people are using that and getting healthier and without side effects. Now, with that said, everything should be somewhat personalized, and there are some people out there. There's a percentage of people that they actually, when they take melatonin, they sleep worse, right? So I always say start with a small dose. Let's say 5 milligrams or less, and see how you feel. And if so, continue to take it, or you can even increase a dose. Like I take 15 milligrams. I found that to be a good spot for me at night before I go to bed. And roughly taking it 30 to 60 minutes or so before you go to bed. That way it has time to get into your system. But more, again, that's going to play a role in maybe 5 to 10% of your sleep quality. The larger amount is going to be your exposure to blue light, where your brain is at night. Are you winding down, or are you frustrated, thinking about what you didn't accomplish, or do you have goals that you're trying to accomplish, right? Because all of that is going to tell your brain, okay, it's daytime, right? I need to be on. I need to suppress my melatonin. And then the other big thing is getting sun exposure early in the day. So when you wake up in the morning, getting out and getting in the sun early actually tells your brain, oh, okay, it's morning time now. So that means in roughly 12 to 16 hours from now, it's going to be roughly 12 hours or so. It's probably going to be time when the sun's setting. So that's going to be when I need to start to release melatonin. So it sets the circadian clock by getting out and getting early sun exposure early in the day.
What is the relationship or the effect of stress and mental health with an autoimmunity?
It's big. It's huge. In fact, that was going to be the next thing that I go into, which is your stress could be from early childhood trauma, which is a big factor. There's actually a scoring test that they use that medicine uses. A lot of psychiatrists will use something called the early childhood, adverse childhood events, the ACE score, your adverse childhood events. And depending on how you score, that can triple your risk of developing an autoimmune condition. if you've had early childhood trauma, for example. Now, that's not the case for everybody. Some people had great childhoods and yet still developed an autoimmune condition. And that just may be the day-to-day stress that we're experiencing as well, right? And so just day-to-day stress, feeling pressure. I know for myself, especially early in my career, I had this big fear of failure. I had a great childhood. I didn't have a lot of early childhood stress. My parents had some financial issues though. And so growing up as a man, I struggled with this idea that I was so scared I was going to fail, right? That I wasn't going to be successful. And that was a big driving force for me. And it put me in fight or flight a lot, right? Because I would see different things happening in my environment and I would think, oh no, I'm not living up to what I need to do. And so that would create this sympathetic response. And my physiology was in fight or flight so much and not in rest, heal, and digest. So when we're under a lot of stress, we're not giving our body time to rest, heal, and digest our food effectively and to heal and regenerate. So we need to be, at times, we definitely need to be in fight or flight. And that's a good thing, right? It helps us perform better. It helps us accomplish things. It helps us do great things in the world. But it needs to be balanced by times where we're in a state where we're resting, healing, and digesting, right? Really good sleep, good downtime, good relationships, laughter. Ideally, having a significant other or somebody, you get oxytocin, right? I've got children. They can be stressors, but they also provide a lot of oxytocin, right? Because I can snuggle them, hug them, high five them, things like that. And so relationships are kind of one of those things. They can be a source of stress, but they can also be this amazing source of connection and oxytocin. And the more that we can obviously leverage that and be in a state where we can have these great positive relationships, and then also time where we can have downtime, rest, heal, right? That's going to allow our body to adapt so we can handle the stressors of life. So really, there's no way of getting rid of stress. And I'm not saying we should. In fact, stress is a beneficial thing. It just needs to be balanced with times of resting, healing, digesting, positive self-talk, all of the different things. I'm not a psychologist, but all of the things that a good mental health expert would talk about would be extremely important here. Positive self-talk, positive relationships, laughter, having fun, right? All these things need to be a place in your life.
Yes, I initially didn't understand this, but now I do. And I do understand that they all play a role in healing. And each one is equally important.
Yeah, absolutely. Super critical. So we've talked about 5 of these 7 root causes. We talked about leaky gut, like I had talked about earlier, that intestinal permeability. Talked about high toxic load, blood sugar imbalances. We talked about childhood trauma or trauma in general, right? It could even be like a car accident, right? Some sort of physical trauma that we had and chronic stress. All of those things need to be addressed. We talked about circadian rhythm dysfunction. In a previous podcast, we talked about nutrient deficiencies, and that's another big one. So if we're nutrient deficient, if we don't have enough vitamin B12, we're not going to be able to heal effectively. We don't have enough zinc. We don't have enough vitamin D, right? We're doing all the right things, but if we're very vitamin D deficient because we're not getting out in the sun regularly, right? We're not going to be able to heal effectively. And so getting the right amount of nutrients and addressing any sort of nutrient deficiencies that we may have. The most common deficiencies are magnesium, vitamin D, zinc, B vitamins, and then in particular for females, iron can be a big one, especially if you're in your menstrual cycle. And we did a whole podcast about that. So addressing nutrient deficiencies, the more that we focus on nutrient-rich foods that are high in nutrients, lower in toxins, the more that we reduce the affinity for these deficiencies, but we still may have them because we may not be getting enough nutrients from the food that we're consuming, or we may not be getting sun, like in the case of vitamin D, or we may have gut issues that are hampering our ability to absorb those nutrients, or perhaps taking medications that are depleting those nutrients. So I think it's key that we address those. In the previous podcast, we talked about starting out with like a multivitamin. I think that's a great place to start. Okay. And then from there, we might learn more about other supplements that can be beneficial, that can really support us as well. And then the last one is chronic infections. And these infections could be gut infections. Some people have parasites in their gut. They could have a overload of bad bacteria in their gut. There's a type of bacteria that can populate our stomach and shut down our stomach acid production. It's called H. pylori. I see that a lot with different autoimmune conditions. So having different infections in our gut, there's also conditions like Lyme disease, for example, which is a bloodborne infection, a Borrelia infection in the blood, right? That can be a factor that drives inflammation. And then there are infections that could be coming from our mouth.
Isn't it from a tick? No.
It's from a tick, yeah. So a tick will be the vector that passes the bacteria. So the tick bites the individual, but these can also be passed from mosquitoes too. Even malaria, right, is a bloodborne parasite that comes from a mosquito. So yeah, the parasite will bite the individual and then the bacteria will get into the blood. Now, a healthy immune system can handle that. In fact, what's interesting is that bee venom or basically being stung by a bee, believe it or not, actually the bee venom itself has anti-Lyme properties, right? So there's actually properties in that kill off the Borrelia bacteria that's associated with Lyme and the Babesia bacteria. So our ancestors would have been in nature, they would have encountered more ticks and mosquitoes than us. They also would have been stung by a bee, right? More often than us. And therefore they would have kind of had almost a natural antidote, right? It's interesting how the stressors that our ancestors faced are different than the stressors we face. And
like telling patients to get stung by bees.
Go on, get stung by a bee. No, I'm not, and I'm not recommending that.
I want to see you explain that one.
Yeah, exactly. I'm not recommending that. I found that there's some naturopaths, I've never used this, but some naturopaths will use bee pollen is common, and then also bee venom actually as a treatment, right? Like a homeopathic treatment for Lyme disease. And so interesting how that works. But with that said, that you can have infections coming from bloodborne bacteria like Babesia and Borrelia from ticks and mosquitoes, malaria. You can have infections from your mouth. This is actually becoming more and more common, especially in our society. At least I've become more aware of it than ever before. People that had root canals. Yeah, wisdom teeth removals where they have cavitations, right? And these infections not being found by traditional dentists, they think the area is sterilized, but there's actually infection into the jawbone that's releasing endotoxins. So I hate having to deal with some of this stuff because I wish that we could just clear everything up with lifestyle. And from my experience, about 80% of people or so with different autoimmune conditions will see significant benefit when they just get their circadian rhythm down, their nutrition right, get good movement in, reduce toxin exposure, and do the things I talked about to help move toxins out of the body. About 80% feel significantly better. But then there's always this tough 20%. And those are the individuals that they may be living in a house that's moldy and that there's mycotoxins that they're breathing in. They may have a root canal that's infected that is leaching out toxins, or they had their wisdom teeth taken out and they've got cavitations.
So you're saying it's like draining down into...
Yes, into the bloodstream, yeah.
Draining down into the bloodstream.
Correct.
Right.
So they're getting all these endotoxins. So basically, when the body senses that the amount of bacteria or bacterial toxins are elevated in the blood, it's going to trigger a strong immune response, right? And so if somebody's not getting better and they're doing these things, we have to figure out what toxins are they being exposed to, right? That are keeping this inflammatory process elevated. Is it mold and mycotoxins from their home or from their office or an environment that they're in? Is it an infection in their mouth that's contributing to this? Is it a Lyme disease type thing, right? And the more that we can minimize that, right, by reducing the infectious load or reducing the toxic load, the better that individual is going to be, the more their body's going to be able to adapt to those stressors, heal and repair itself more effectively. So sometimes we have to get holistic dentists, like good dentists on board to clear out an area where there was a root canal that got infected.
Yeah, the last place you would look for an answer is oral health, right? Like I don't think that you would go looking at your teeth for an autoimmune condition. That seems like disconnected.
I was in school for a long time, got multiple degrees. I really never learned much about the importance of oral health. This is something that dentists have really taught me more about, just learning more about, okay, like these really tough cases. I've realized that many of them have had oral infections that were keeping them from healing. And so this is something I found more from experience. And recently I've done more research and looked into it more. But, a lot of people with chronic sinus issues, right? For example. And so this is it's a big issue, right? Also, especially in your industry, breast implants are a big factor, right? I mean, I don't know how prevalent that is in India, but in America, it's huge, right? And so a lot of women are getting breast implants, and these breast implants are really toxic. And there's a growing condition called breast implant illness, where a lot of women that have gotten the breast implants, they're leaching out, right? And there's chemicals, a lot of chemicals that are getting into their bloodstream. A lot more actresses are coming out and talking about this because there's pressure on young women in our world today, right? To have a certain appearance, and breast implants are so much easier to get, but there are tons of chemicals and toxins that are in them. So that's another big factor.
I think that this has been the most comprehensive discussion on the root causes and also the healing practices that one can begin with. Like you've given us an almost like a journal to keep with the step-by-step healing process. And thank you for that. I wish I had this 2 years ago, but I'm really, really glad that we can do this now and we can talk so much in detail about autoimmunity and provide this to the listeners to be able to make informed decisions and with an absolute understanding of what they're going through.
Yeah, absolutely. And I know this is a lot of new information for a lot of people. And I want you to know that they say a journey of 1,000 miles begins with a footstep, right? So just start taking one step in the right direction. That's the best place to start. If you want to learn more, obviously, Samantha, I know you put out some good content on this in the past. Also, you can check out my podcast, the Dr. Jockers Functional Nutrition Podcast. And also, I've got blog articles on a lot of these topics as well for more further information on this.
I'm going to also take questions from the listeners if they have further questions, and maybe do a follow-up episode with you just answering their questions, which would be mighty helpful maybe.
Let's definitely do that.
Thank you so much for your time, Doctor.
Absolutely. It was an honor as always, Samantha.